Hi, I'm Sharon Notch, and I'm the marketing representative for UCare. We're one of the many different health plans that are out there, as you know. But here today, we're going to talk about some of the basics and things that are changing for all of you that are on Medicare, right? There's a lot of stuff going on. I did actually, as we were mentioning, I used to work for the Senior Linkage Line for 8 years for the Area Agency on Aging, and then I left that to go to the Disability Linkage Line for 4 years as a coordinator. And from that job, I've been now with UCare for 7.5 years. So I have about 20 years experience working with the Medicare arena, and I think it's really important for all of you to understand what's going on. There's a lot of stuff, isn't there? Yes. Now, I'm going to ask some questions here. How many of you in the room are currently on a cost plan losing your coverage December 31st? Most of you in the room are. So this is becoming quite overwhelming because you're getting so much mail. All your friends are doing this or that. You're getting differences of opinions on what you should do and not do, and it's kind of confusing, to say the least. So, yes, ma'am?
Can you explain what a cost plan is?
I will explain. The question is, can I explain what a cost plan is? And absolutely. So in order to kind of keep this in a little bit of a structure for you, I gave you all a PowerPoint that's in front of you. I'm going to move back. We're going to follow along with that a little bit just to keep you on task. So I'm going to have you turn to page 4 that says what you're going to learn today. And what we're here to learn about today is basically what is changing and how you can better prepare for what's going on and understand how is the Medicare plan change that's going on impacting you if you're currently enrolled in a cost plan, as well as how to choose the right plan. So what's changing is effective January 1st, 2019, the federal government passed a law that said insurance companies that sell a particular type of an insurance plan called a cost plan will be ending December 31st. So what happens with that is there's about 370,000 cost plan members in Minnesota. And to give you a little bit of a perspective on this particular type of an insurance policy, there's about 800,000 cost plan members nationwide. Okay? Minnesota has almost half of them. Okay? I don't think a lot of people realize that. And what is happening is in 66 of the 87 counties, these particular products called cost plans are not continuing. They can no longer be sold, okay? There's 2 reasons for that, which I think a lot of you maybe that are currently on a cost plan aren't aware of even why. Do you really understand why they're going away? And there's actually 2 reasons. When you're enrolled in a cost plan, the government is saying that if there are 2 or more competing Medicare Advantage plans sold in those counties, with enough of an enrollment, then the cost plans are due to end, okay? You have 2 competitive Medicare Advantage plans that are sold here, and I'm going to explain the difference of what an Advantage plan is, what a supplement is, and what a cost plan is so that you have a little bit better understanding. But that's one of the reasons they're ending. The other reason that they're ending is because the federal government passed this law several years ago that said these particular products actually are depleting the Medicare trust fund. So Medicare is still paying for part of the benefits for people that are enrolled in a cost plan. Medicare is still paying part of the bill for you. And the government is saying that it's depleting the Medicare trust fund because of the way it's being paid. So they have said that the choices you will now have from now on are to go to a Medicare Advantage Plan Part C or a Medicare Supplement, okay? And there's a lot of similarities between those products and what you currently have as a cost plan. Now, I will tell you, one county not far from you called Mille Lacs gets to keep the cost plans. Because there's not 2 or more competing Advantage plans in that county with enough of an enrollment based on population. So it's all based on our population, and if there's enough people in 2 or more competing Medicare Advantage plans. And you'll know the difference of what an Advantage plan is versus a supplement in just a minute. So people that have, and UCare is just one of many Medicare Advantage plans that are on the market. There's tons more coming next year in 2019, but there's a couple other Medicare Advantage plans currently sold in 2018 that are not impacted. Okay? If you're currently enrolled in a Medicare supplement, it's not impacted. But let me ask you this. How many of you that are on a cost plan thought it was a supplement? Right? We all use that terminology when you're on Medicare. It's common to think that whatever we're enrolled in is our supplement. But there are clear distinctions between the different types of products that are sold. So I will give you a piece of advice, and you can take this if you would like to. I would really encourage you in the future to really understand the type of product you're actually on. Is it a supplement? Okay. What kind of supplement? Because there's lots of them. If you're on an Advantage plan, what type of Advantage plan? Okay, because it's different. So I'll explain those to you. So if you turn your page, please. What this means to you is that you're going to be offered either, some of you are in a particular company that has already auto-enrolled you, passively enrolled you into their new product they're offering. Some of you may have got a letter from your company that said they're putting you in this different plan, right? And you have the choice to take this plan if you want or not. So that's one thing you can do. You can be introduced to many other options. How many of you are getting a pile of mail every day? Right? Constantly. And if you've given permission to us insurance companies to call you or agents to call you, they're going to call you. Because in all reality, there's 300,000 people up for grabs. So if you look at it, and I'm being very honest with all of you, if you look at it from an insurance perspective, that's 300 opportunities to our plans, right? So that's why you're being kind of, I don't want to say attacked, but you kind of feel like it's attacked and bombarded, and it's all about finding what's going to be right for you, okay? So that's what the bottom line will be. So starting October 1, you could see all the different plans that are available. All the new information was released. You could start comparing. Plans could start telling you how much their premiums were going to be, right? And what the co-pays were going to be and what the drug coverage included, stuff like that. You could start attending meetings. How many of you have been to informational sales meetings already? How many of you have an appointment with your insurance agent? Some of you? Yep. So, and they're booked. They're booked way behind because everybody is just swamped right now because of the busyness of this. But you have a window of time starting October 15th to make some changes and comparisons. So how do you prepare for that? I'm going to get to this lady's question now about the different types of products. So when you start comparing, and I'm on page 8 of your PowerPoint, when you start comparing plans, I'm going to spell out the differences for you between a Medicare supplement, a Medicare Advantage plan, and then fill you in on what the difference was of a cost plan, okay? So you can enroll in a Medicare supplement, okay? There's different names and different types of supplements. So you don't have to write these all down, so please don't feel like you have to take notes. But when you hear the terminology supplement, that can include Medigap, Medicare Select, Medicare Basic, plans F, K, L, M, and N. There's all different types of supplements. But the bottom line and the similarity that they all have is they all pay second to Medicare. So if you enroll in a Medicare supplement, Medicare's primary. Medicare always pays first, no matter what. Medicare has to pay first. You pay your premium to your Medicare supplement, and then you have to buy Part D separate. So you carry your red, white, and blue Medicare card as primary, and you pay your premium for Medicare. You all know you pay your premium. Currently $134 for most of you, going up to $135.50 next year for most of you. So Medicare is primary, your supplement's secondary, and then you buy Part D separate. If Medicare pays on that bill, your supplement will pay second. Okay? And you can pay different premiums for a supplement. It depends upon the company. It depends upon what kind of supplement it is. Okay? But the bottom line is Medicare has to pay first. Okay? The positives of supplements is that you can go to any Medicare provider in the nation that accepts Medicare and not worry about, am I in the network, am I out of the network? Okay? Again, that's the big thing that a lot of people like, is that flexibility. Depending upon the premium you pay for your supplement, you should not have copays for medical services or hospital services. Okay? Supplements do not include Part D, we already know that. Typically don't include any dental, any eyewear, any fitness, any worldwide emergency, stuff like that. They only cover what original Medicare covers, unless you buy an extra rider or buy the right kind of plan that has some of those things built in. Okay, those are supplements. Then way over here, and I want to make sure I don't get any echo, way over here are your Medicare Advantage plans. Okay? So what the Medicare Advantage plans are is they get paid by the federal government so much money per month per member to administer your federal Medicare benefits for you. You've heard the term Medicare replacement. Medicare Advantage plans are called Part C. They take all your Part A benefits, you know, your hospital, your nursing home, your home health care hospice, and your Part B benefits, your doctors, your specialists, your outpatient surgeries, your chemo, your medical equipment, and roll it into one plan and can add Part D drug coverage to it. Combine, coordinate Part C, all in one. Kind of like your cost plans were, where you got everything in one package in some cases. Medicare Advantage plans, which again are on this side of the room, often include fitness benefits. Many of them include dental. Many will include eyewear. Many will include worldwide emergency benefits. They add extra things that original Medicare won't cover and doesn't cover, okay? But with Medicare Advantage plans, you have a network, okay? So the networks can be very, very large, very extensive. They may give you travel anywhere you go. You got to check with the plan. The reason people like Advantage plans is because they tend to be sometimes lower priced, but you have copays, okay? There may be some copays included with a Medicare Advantage plan, whereas a traditional supplement, there typically aren't. If all you want to make sure is that I have everything covered after Medicare pays first, I don't want to have any bills, I don't want to worry about a copay, I don't want to worry about a network, I don't need dental, I don't want fitness, I don't need hearing aids, I don't need eyeglasses, those kinds of things, supplements are very popular for those people. For Advantage plans, what people look at is I pay this premium, and yes, I have copays, but I have a max out of pocket. Have you all heard of the maximum out of pocket before? Because you had one with your cost plan. And they vary anywhere from $3,000 a year is your worst case scenario, as high as $6,700 a year. Typically, that's common. So when you're comparing plans and looking at prices, you're going to look at, with Advantage plans, who's in their network, what's their max out of pocket, what's their premium, okay? Does everyone understand a supplement versus an Advantage plan, at least those two things? Kind of? Kind of? It's confusing because they all cover and have to pay on what original Medicare covers. That's the bottom line. That's at the core of all of them. It boils down to what do you want to pay, what extras do you need, those kinds of things. Yes, sir.
So, on the Medicare Advantage plan, then, what you're saying is that they're taking over the $135.50 or whatever that we're paying, and then charging you an additional premium on top of that in order to cover everything. So that's the reason some of those Advantage plans are zero cost?
His question is it, and I'm going to reiterate this for you. He said, is that what you're saying is that Medicare Advantage plans take that $134 Part B premium and then plus get paid by the Medicare government to do the work and then take over and have to do that? Is that why they have some plans that have no premium and a really high max out of pocket? Actually, what happens is you still pay your Medicare premium to the federal government. They keep that money. But what the federal government does is they pay every Medicare Advantage plan that's on the market a certain amount of money per month, per member, per county, per state that they live in. It's called a capitated amount. It
should be decapitated.
I know, but it's because in rural Minnesota they say that it costs more money to in some areas to provide service. And I live in rural Minnesota too. I live in Todd County. I live in Eagle Bend, very, very small community. But what the Medicare Advantage plans do, and I think this is important to remember, the Medicare Advantage plans, because the federal government is paying all of us money to do the work, who's controlling what we do with that money, right? So they have something, and this is a lot of information, but it's important to understand because you don't want to join an Advantage plan and say, well, they're going to do with it whatever they want, right? So what will happen is with that Medicare Advantage plan, when they get paid that certain amount of money, there's something that's called a medical loss ratio that says, the federal government says that all those Medicare Advantage plans have to put at least 85% of the money that they receive or more into their product for benefits for a member or paid out for claims. So it's a way the government can make sure they monitor the Advantage plans, that they're using the money to the best potential they should. But they become the main payer. Did I answer your question clearly enough? So there are advantages to Medicare Advantage plans. There are advantages to Medicare supplements. They're both excellent products. It's going to boil down to what fits for you. It really is an individual decision. I've already told you some of the pros and cons. The Advantage plans, similar to what your cost plans did. Ma'am, I didn't get to your question very well, did I? So the difference of the supplement versus the Advantage plan, and you've got the cost plans in the middle. You all know that your cost plans often included a lot of extras for you too, didn't they? Some of your cost plans gave you some eyewear benefits. Some of them gave you some snowbird benefits, right? The cost plans allowed you to bump up and down in the middle of the year if you needed to have surgery. Did anybody ever get to do that? Yep. You start off on the lower premium plan that may have some higher copays, and then you knew you were going to need surgery, so you kind of bumped up to a more expensive plan. That was allowed. Nothing was wrong with that. That was allowed because the product allowed that. But the cost plans are paid differently by the federal government. And I don't want to go into great detail. I got to be really careful what we say here on it. But the cost plans do receive some funding from the government as well. The thing that you want to know is that Medicare Part A, hospital, skilled nursing, home health care, hospice, when you're enrolled in a cost plan, they are the main payer for all of those services for you, not your insurance plan. So even though you might have had a really small copay for the hospital, the bulk of that bill was paid by Medicare. When you're in an Advantage plan, the bill is paid by your Advantage plan. You're going to have a copay, but the Advantage plan pays it. If you're in a Medicare supplement, Medicare is primary, your supplement only picks up second what Medicare didn't pay. So it's all in the way that it's funded, is why it's different. Yes, ma'am?
When you go through an agent, does your health play a big role in the plan that they kind of pick out for you too?
Her question was, when you go through a local agent, does your health situation play a big part in how they're guiding you and helping you to make a decision? In a lot of cases, yes, because what will happen is agents will, and with all respect, agents will look at if you're someone that's on a lot of medical equipment or needs cortisone injections every month or chemotherapy injections, you know, with a Medicare supplement, supplements will pick up that 20%, okay? You might be paying a little bit higher premium up here in the very beginning to get that covered. And they might say, well, if you go on this Advantage plan over here, your premium's gonna be this much less, but you're gonna pay maybe 20% of those injections. So they'll look at that and point out the financial differences for you. But what you look at is if you go with that Medicare supplement, you know, look at what your premium will be, look at what your drug plan will be. Is that affordable for you and does that make sense? Or if you go to an Advantage plan, what you look at is there's going to be some copays. Even with, you know, all of them, there still might be some copays for something medically. So depending upon the premium that you're paying, what is your max out of pocket? You know, example, if you did something where you had a plan that was maybe $100 a month and it had, you know, some copays and your max out of pocket, let's say, was $4,000 a year. If your premium is only $100 a month, can you save some money in case you have some copays to go towards that max out of pocket of $4,000? Because your premium is only this much money. Does that make sense kind of for everybody? And I'll show you that little worksheet I gave you too that might help explain that as well. So again, look at what plans are affordable. Some of you may not use the fitness benefits these plans include. Maybe you don't need dental. Maybe you don't need eyeglasses this year. Maybe you don't need some of the extra perks the Advantage plans try to throw in, right? The thing that's going to be important is finding out what's going to be right for you. All the Advantage plans, when you start looking at them, there's a lot of them, is, again, what sets this one apart from this one? You know, where are they based out of? Sometimes that's important. You know, you look at what your co-payments are. What are your deductibles? What's your max out of pocket going to be? What's your monthly premium going to be? Those types of things. Prescription drugs. Are any of you on a lot of medications? Any of you hit the donut hole or the coverage gap? I remember when Part D started way back in '06. Many of you may not have even been close to Medicare age back then, but you might have had a parent or a loved one that you helped back then, but it was an overwhelming time back then, and that's when I worked for Senior Linkage Line, so I remember it very, very well. The Part D drug benefits, again, if you go with a Medicare supplement, again, pick the plan that's going to be the right one for you. Know that if you buy a supplement, you do have to buy Part D separate because they cannot include prescription drug coverage. That's bottom line. So if you do a supplement, you have Medicare supplement Part D, 3 cards, 3 entities to deal with, and it may work quite well for you. If you go with the Advantage plan, if you want Medicare Part D, you have to take it through them. Because the Advantage plans will include Part D in most of their products. Some of the Advantage plans, like this gentleman mentioned, that have maybe a real high max out of pocket may not include Part D, and some plans are created to appeal to veterans that have drug coverage from the VA and maybe need a catastrophic plan or a civilian plan to work with in case something should happen to them.
So if you have an Advantage plan, you can't buy a second supplement drug card. It has to be included in the Advantage plan that you purchase.
Yes, to reiterate the gentleman's question, if you enroll in a Medicare Advantage plan, and remember, there's different types of Advantage plans, different names of them, HMOs, health maintenance organizations. You don't have to remember this. PPOs, preferred provider organizations, if they have Part D, if they're offering Part D, it's included in the premium you pay. So it's the federal Part D drug benefit and follows the federal model, but they embed it in their premium. That's why they're called coordinated care. combined. It puts it all in one, Part C. So you're still getting your federal drug benefit, but it's built in the premium. So then that way you have one company to deal with, one entity if there's questions on bills or claims. It's supposed to simplify for the people that that product would work for. And the product may not work for everybody. And the products won't work for everybody because everybody has different needs, right? You all have to decide what's going to be the right thing for you. And no plans are better than anybody else's either. And I may be a little bit bold by saying that, but I think it's important for you to know that. There's excellent companies out there. So it's finding what's really going to fit right for you, that meets the needs that you have. And it's right for you, and what's right for you, and it's individualized. Okay? How many of you are snowbirds that travel? A couple of you. So then that's going to be important for you. Remember, Medicare is a national program. The United States of America and the territories of the United States. So if you travel, if you're in Texas like my dad and you sneak into Mexico, and I shouldn't say he sneaks, but there's a certain spot that he crosses when he goes over there. So when he goes into Mexico, if something happens to him there and you're in America, Medicare is national. If something happens to you in Mexico, they're not going to fly you back to the United States. Do you have travel coverage? Those kinds of things. Does the plan you're looking at cover you for foreign travel? For some of us, we don't go anywhere, right? I was in Roseau yesterday. That's the farthest I go away from home. But, that's what you look at. What's going to fit for you. So again, when you start looking at even the supplemental insurers, so supplemental policies as well as Medicare Advantage policies, where are they based out of? Who do you call? If you go through local brokers, you have local brokers and agents that you respect, right? That you've built a relationship with, some trust with. They are your insurance agent to help you if there's issues. If something comes up, you enlisted in them to be your agent to help you work and sort those things out. You look at the quality ratings. This is really, really important. All of you that were enrolled in a cost plan, did you all know you had a star rating? That your plans were rated every year? I would encourage you to make sure you pay attention to that in the future. Medicare plans, cost plans, Advantage plans, and Part D drug plans are rated every year on how well they perform. Okay? So for your plans, the highest they can get is a 5-star. So it speaks to the quality, the customer service, are they managing chronic conditions, things like that. So it's really, really important. And those ratings change every year. The new ones were just released about a week and a half ago. Okay, so check those things out as well. So then how to choose a plan. If you want to look through your packet again, I don't know what page I'm on, but I think I'm on page 15. So when you're choosing a plan, again, the 3 companies that are losing the cost plans still have products available. Okay? With all respect to them, the cost plan they sold is what ended. They still have options that you can look at. Okay? So keep that in mind. Look at those, see how they compare to some of the other ones that are on the market. Make sure you do compare though, to have an idea of what's out there, what's going to fit right for you, that type of thing. I remember talking with a family member and telling them that this was coming, because we've known for a couple years. This was a federal law that was passed a few years ago that said these cost plans were going to sunset. We all knew this was coming. And I kept telling her, now be mindful, watch for your information. These cost plans are ending. And she was like, I'm not on a cost plan, I'm on a supplement. I'm like, no, you're on a cost plan. Because when you look at the names of the plans that you're on, and that's why, again, with all advice I can give you, please be mindful of what plan you're on. Try to have a better understanding of what type of plan it is, and if it's a supplement, what type of supplement? Because there's different ones, okay? So go to sales presentations, work with a licensed broker, agent that you work with, that you trust. If you're internet savvy, how many of you are internet savvy? Okay, some. You can go online. I can tell you that you get this Medicare book every year, right? So the Medicare book has all the Medicare Advantage plans listed in the back, and all the Part D drug plans are listed in the back. The only thing that's missing out of the Medicare book are the supplements. They're not listed in this because supplements are regulated by the Minnesota Department of Commerce. Okay? So I'm going to give you a toll-free number for the senior linkage line, and I think you all probably know this, but they also put out a healthcare choices guide every year that has all the 2019 plans listed in it, including the supplements. They don't even have the hard copy in their hands yet. Okay, but it's online and they can print you out certain pages. So it's 1-800-333-2433. So 800-333-2433. That is the senior linkage line, which with Medicare, they are your Minnesota SHIP state health insurance program, your neutral advocate that you can go to. That's what I used to do. That was my old job. Okay? You have really great advocates that can help you compare. They can send you out the different plans, and that's the most neutral way to look. Or you can go on the Medicare.gov website and do a comparison. And Christine said I can go online here and show you how the Medicare website works. If you aren't savvy enough to do that, that's okay. Senior Linkage Line will enter your medications in the Medicare website for you and give you an analysis of which top plans will cover your meds. That's what your insurance agents do too. One thing that is happening, and this is a piece of advice for you as well, if you're any individuals that are out there that may be eligible for low income help, Social Security has a program called Extra Help or Low Income Subsidy for people whose income and assets are a little bit lower. If you're a person that may be on that program, then they get help with their Medicare Part D drug plan. And if you're on a cost plan this year that has the drug plan built in, you know, your coverage is done December 31st. So for those individuals, the government may have auto-enrolled you into a drug plan, and that's why some people randomly are already getting an ID card. I met with a couple in Eagle Bend the other day. Same thing happened to them. She's like, why did I get this card? And it's because they're on the Extra Help and they automatically got enrolled into a drug plan just in case they don't do anything else. Because there's going to be a group of people on cost plans that do nothing, right? We all know that person that may not think anything's changing, and they don't do anything by December 31st, and they revert right back to Medicare and no health insurance because their coverage ends December 31st. So that sometimes happens. Another thing is, and I talked to Christine about this earlier, how many of you have gotten a letter from Medicare.com? It's not, okay, that's all over the place, and it gets people kind of a little bit nervous, and it's got to be I think it's some type of insurance entity behind, but it's a marketing tactic. I've already talked to Senior Linkage Line about it. They've gotten several calls about this. I did speak with Kelly Jo Greiner there to say, hey, we're hearing this all over. And Medicare.gov is the federal Medicare system. .com is just another website. Medicare.gov is the federal system. Okay, so keep that in mind. So once you make your decision, again, I want to tell you a couple more things about this, your timeline, if you want to follow along. So most of you are used to the timeline of having to make a decision October 15th through December 7th, right? Right? That's open enrollment. All of you that are currently on a cost plan losing your coverage, right? Your coverage ends December 31st. You all know you have till December 31st to make a decision, right?
Right.
Right? And you all know you have guaranteed issue rights. That is really important. You are going to be given an opportunity to get a Medicare supplement with no pre-existing conditions, because supplements can have you go through a health screening. Okay? Medicare Advantage plans can say if you have end-stage renal disease or kidney failure, they can't take you. But none of these plans can have any pre-existing conditions against you now because you're losing your coverage. Okay? So special enrollment period because your plan is ending its contract with Medicare, which means you have till December 31st to make a decision, and then you have guaranteed issue rights. So the friends of yours I'm talking about that may not do anything, how many of you know someone that doesn't even open their mail? Right? There's some of them. So let's say you have a friend that's on a cost plan, doesn't do anything. So his coverage ends December 31st. January comes and he goes to the doctor and has this huge bill because he didn't have any more insurance but Medicare. Okay? Or he doesn't have a drug plan anymore because whatever happened for his situation. So now he has still, if that happens to anybody, they still have January to enroll for February 1. They still have February to enroll for March 1, but that's it. Okay? So the main thing for you to remember, if you're currently on one of those 3 companies I mentioned to the gentleman in the back, and your coverage is ending December 31st, okay, you have that period and you have guaranteed issue rights, no health screening. There's also going to be one more new window. There is going to be an open enrollment window the federal government is creating where you're going to be able to have a chance to make one change a year. If you join a Medicare Advantage plan, you'll have one time, January 1st to March 31st, to make one change. Okay? Let's say, because I can talk about my name, UCare. Let's say you join UCare for January. And then you decide, and we're an Advantage plan, and then you decide in January that, oh, this other company had this Advantage plan, and that one might have fit me better. You can make one change and go to that different company, and then you have that plan for the rest of the year. And then you'll fall into that open enrollment every year, October 15th through December 7th. But this guaranteed issue right thing, that's only because your plan is ending its contract with Medicare. Yes, ma'am.
Why did they use the end-stage renal disease when you could have terminating cancer, you could have a lot of things that are going to be just as dangerous?
Her question was about why do Medicare Advantage plans use end-stage renal disease as a specific criteria to not enroll people at this point? Again, you could if you were on a cost plan. It's because Medicare has a specific type of Medicare itself for people in end-stage renal disease. There's different types of Medicare for people based on diseases, and that is one situation. Medicare Advantage plans can't use that anymore in 2021. So that there won't be that health screening piece at all there at that time. Okay? We're done with that. So I can take some questions from you, but it will show you the Medicare website. And another thing that I gave you is you have a copy of this simple little health plan checklist. I talked longer than I thought I would, Christine. I said, I'll never fill an hour, but look at me go here. So when you're comparing plans, you probably have a bunch of different books and pamphlets in front of you right at home with prices and all this. Take this little worksheet. I'm still really old-fashioned that I want to see pen to paper. I want to see it in front of me. I want to spell it out. So take 3 different plans that you're looking at. Take a supplement, and then take a Part D plan that might work well for you and figure out what the price is going to be. We ask you basic questions that are very common What's my premium? Does it include Part D? Well, if you know if it's a supplement, the answer is no, it doesn't. So you got to buy that separate. There won't be a max out of pocket with Medicare supplements. Okay? There are with Advantage plans. So be able to ask yourself some questions, and it can kind of help you start weaning out and weeding through the ones that might fit or not fit for you. Okay? If this would help you. We use these at our Medicare sessions that we hold, our Basic 101 classes, to help people kind of see it in reality, what it might cost them. Okay?